This is the Berman Method podcast featuring Dr. Jake Berman and physician assistant Jenni Berman. We are here to treat problems and not symptoms. Disclaimer, this podcast is for entertainment purposes only and not to treat anyone or to give medical advice. If you are interested in any information that we are giving and would like to use this for yourself, we recommend that you contact your primary care physician or reach out to us and ask us questions about yourself specifically. Enjoy!
And we're back, baby. The Berman Method podcast, where we are David going against Goliath, where Goliath's the corporate medical system. We're saying, F you ain't doing it right. You do not have the patient's best interests in mind. Look at Jenni. We need to start video recording this stuff because the looks that I'm getting right now.
I'm Jenni Berman, physician assistant.
Dr. Jake Berman here. Good morning. Hopefully you're listening to us first thing in the morning and that woke you up with a smile, with a nice F you right out of the gate.
Happy Monday. In November. It's like officially pumpkin month now.
Officially pumpkin month? I thought it's been pumpkin month. The PSLs have been flowing since September.
It's true, but now it's like real. It's November, it's fall, Thanksgiving's in a couple weeks.
And just so everybody knows what PSL stands for.
Pumpkin spice latte. I've never had one.
Yes, the PSLs are flowing, baby. They're flowing. We are in November.
And just FYI, lattes are really high in calorie.
Horrifically high in calories.
And sugar.
Yeah.
Yeah. So try not to go for the lattes, but you can go for an Americano with a splash of coconut or almond or oat milk with a pump of sugar-free something. Just one pump of sugar-free vanilla, one pump of sugar-free caramel.
They don't have sugar-free pumpkin?
No, it's not a thing.
That's BS.
So if you have one pump of pumpkin like once, enjoy it. But I'm just giving you some other options of lower calorie and sugar, delicious tasting coffees.
You know how many people have a PSL in their hand right now as they're listening to this and you're just raining all over their parade?
Enjoy it. But then it's time to move on.
Enjoy one a day, one once in the morning, one in the afternoon.
No, like one a month for November and December.
Oh, this place is a prison.
All right. But, life is not that bad. Because you can still have your Americanos with your oat milk and a pump of sugar-free vanilla. It still tastes good.
You know what I'm really digging lately is iced coffee with oat milk.
Yes.
Yeah.
You do like that.
I really do like it. So not cold brew? Not cold brew, because that stuff, holy cow. Had one of those the other day because it didn't have iced coffee and it's like, zoom, 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 zoom. Zooted. Like, let's go run a marathon.
It was kind of nice it was on one of our long drives since we've been traveling a lot lately and you didn't want to go to sleep on the drive. It was kind of nice. You should do it more often.
Jenni hates it when I sleep in the car and she's driving. Hates it.
Well, now it's especially challenging because he doesn't sleep for like 10 minutes. He sleeps for like an hour and a half. And we have our 2-year-old in the backseat like, Mama, 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 Mama. While he's just sleeping and I'm driving and I can only do so much in the front seat driving. Mama, Mama. And Dad doesn't even ever hear. So anyways. All right. So it's November. Yeah, we're back to it.
It's November, and one of the things that I wanted to talk about is the basics. I wanted to go back to the basics because it's so important that we do not get the curse of the professional. And what the curse of the professional is, I'm the professional in physical therapy. I'm the expert. I have my doctorate in physical therapy. And a lot of times I will underestimate the importance of the basics. And I will focus on much higher level, much more complex things that are 9 times out of 10 far like over other people's heads as far as layman's goes. So I have to remind myself that this is my expertise. This is my field. I eat, sleep, breathe, dream this stuff every single day, versus Bob down the street didn't go to PT school. He didn't have anatomy class. He hasn't been in the field for 15 plus years. And when his back starts hurting him, he has no idea why his back is hurting him. He doesn't know what to do. He doesn't know if he should rest. He doesn't know if he should ice. He doesn't know if he should take pain medicine or ibuprofen. He doesn't know if he needs an X-ray or an MRI, if he needs an appointment with his primary care physician or an orthopedic surgeon. He doesn't know. So what's the worst thing that you could possibly ever do when you have back pain?
Google. Was that not it?
Yeah, I guess I could argue that. Yes, Google, because then you happen to see, what is it? MedMD or WebMD.
WebMD.
WebMD is the first thing that pops up, and causes of back pain, cancer, herniated disc, something that requires surgery.
Yeah. That's the worst thing in my field for people to do.
Google.
Yeah. They're like, I've had this stomach pain for 2 days, so I went on Google and it says that I have IBS. Or you're just constipated.
Yeah. Or you didn't drink enough water and you're freaking constipated.
Right. So was that not the right answer though for you?
It kind of is the right answer, but technically the answer that I was looking for is rest.
Oh.
So a lot of times when somebody's back starts hurting, they think that they just need to take it easy. I need to rest my back.
Take it easy, man. Our 2-year-old says that and throws up a peace sign. Take it easy, man.
And she drags out the man just like that. I'm proud of that because I taught her that.
Okay, but that's not the right answer when you wake up with back pain, is to just rest and take it easy.
That is not the right answer, especially for my golfers out there. I got a ton of golfers that think that when their back flares up, they need to take it easy. They need to take a day off, a week off, a month off from golfing and just let their back recover. And it's the exact opposite of what you should be doing. Now, don't get me wrong. I'm not trying to say that when your back flares up, you should golf more. But what I am saying is you should not be taking it easy. You should not be resting.
What about my back hurts? I'm going to call the ortho or the chiropractor.
Holy shit.
That's not a good answer either.
Well, I guess it really depends on what answer you want. If you want a quick answer, then yeah, sure, call it the chiropractor. Go and get an adjustment, and I'm sure that you'll feel really good walking out of there. I don't know how long you're going to be feeling good. If you want a really long, drawn-out 3 to 6 month long answer, call your doctor.
Because then you go get an MRI and then you have surgery.
You're skipping so many steps.
Oh, okay. So what's the right answer? Don't stop moving.
The right answer is motion is lotion.
Okay.
So when your back tweaks, the right answer is motion is lotion. And it's very rare that your back will start hurting more the more you move. And now everybody needs to pay attention to this because it's important that it's a really synonymous with the saying, practice makes perfect. No, practice makes permanent. So perfect practice makes perfect. So we want to make sure that we're doing things perfect, or at least as close to perfection as we can. So when I say motion is lotion, your back is hurting. So I want you to go move. What I want you to do is I really want you to move intentionally. I want you to move using muscles. So engage your core, pull your belly button in towards your spine like you're trying to fit into a tight pair of pants, and squeeze your glutes as hard as you possibly can. When you do those two things, what it does is it takes the pressure off of your low back and gives it a chance to heal naturally. And that's when you start getting the motion is lotion effect into play and you can start moving again. So to give an explicit example of the worst thing that you can do is rest is, I just bent over to pick up a pencil and my back locked up. I just sneezed and my back locked up. I didn't even do anything and my back locked up. That is when you should absolutely not be resting. The reason why your back locks up is because your pelvis is out of alignment. So fix your pelvis. I've got 5,800 videos on my YouTube channel on how to fix your pelvis.
5,800. Is that similar to 11 billion?
Similar to 11 billion. It's actually the number just shy of 11 billion.
Okay. Got it. So we'll link those on the show notes?
Sure.
Okay.
Yeah.
So people can learn how to fix their own pelvis.
Yes. So we talked about back pain. What's the first thing that you should do?
Keep moving.
Keep moving. What's the last thing that you should do?
Rest and Google.
Yes. Good.
Okay.
Do you need an X-ray? Period.
If.
Period.
Ever.
Ever.
Question mark.
Ever.
No.
Remember, we're talking about atraumatic or non-traumatic pain. So you weren't doing anything and your back flared up on you. You weren't doing anything crazy. Like you didn't fall. You were not in an accident. There was no trauma and your shoulder started hurting. You didn't do anything and your neck tweaked. You didn't do anything and your knee started bothering you. You don't need an X-ray for those things. You just don't. Because what happens when you get an X-ray?
It's going to show something.
It's going to show something.
And that something's probably not causing your pain.
Correct.
So then you're going to get treatment you don't need.
Correct.
Okay.
So let's use knees, for example. There's a lot of people suffering with knee pain out there and just kind of working through it or limping along or quote unquote, I'm doing air quotes right now, putting off a knee replacement as long as they possibly can because their doctor told them that they're going to need one sooner or later, or they're blaming their parents. My mom had bad knees, so I have bad knees. We always have to go back to the example that I try to give most often, and that is when I first started my career, I was working with somebody with multiple people actually, but this one particular person, working with him a week after having a knee replacement. And the first week is usually the worst week because the block just wears off and it just hurts like hell. And he's going, man, I'm really not looking forward to having the other knee done. I said, why do you have to have the other knee done? He said, well, the other knee is actually worse than this knee was on X-ray. The other knee is, there's no cartilage left. But this knee is the one that hurt more, so we decided to do this one first. And I'm going, what the hell? Your other knee is worse on X-ray, bone on bone, no cartilage left. But it didn't hurt as bad as the other knee that did have some cartilage left on X-ray.
So the X-ray wasn't telling the whole story.
Wasn't telling the whole story.
The X-ray, again, is telling us something that is not actually causing the pain.
Correct. The X-rays and MRIs are just tools. That's all they are. The problem that Western medicine has fallen into is utilizing these tools, X-rays and MRIs, as diagnostic / prognostic indicators on what the plan of care needs to be. For example, you have knee pain, you have back pain, you go and get an X-ray and it shows that there's degeneration in the joint. So usually what happens next is they order an MRI. And then the MRI confirms that there is degeneration and now there's getting compression on a nerve root or something going on in there.
Right.
So then the surgeon never even looks at you. They're just looking at an X-ray or an MRI and says, yep, that's where they're pointing with their finger on this image saying, that's where your pain's coming from. We need to do surgery.
Right.
And don't get me wrong, not all surgeons are like this. We've actually got a handful of very conservative surgeons in this town that we refer to constantly when necessary because of how conservative they are. However, I'm talking about Western medicine. I'm talking about Goliath right now. The problem in America is that these surgeons are using these tools as diagnostic and prognostic indicators, meaning that because your x-ray shows that you're bone on bone, you need to have a knee replacement. So let's do it.
Right. Without evaluating to see where the pain's actually coming from or trying a good physical therapist to see if they can evaluate something different other than the bone on bone actually causing the pain.
Yeah, because you got to think about it. Why? We've got two knees, and 99% of the time, one knee is worse than the other knee. Yet we blame it on arthritis. My knees just wore out. You got to ask yourself, why did one knee wear out faster than the other knee?
Right. Imbalance.
It's not the knee's fault. It's something else, somewhere else, not doing its job, which is placing more stress, more compressive forces on that knee compared to the other knee. So yeah, go and get a knee replacement. You're going to solve the problem of the bone on bone issue because now it's going to be plastic on plastic.
Right.
But you didn't solve the problem of increased stresses on that joint. Just because the joint is now artificial and not real doesn't mean that it's not painful anymore. And we see this at least on a bi-weekly basis, if not a weekly basis, where we'll talk to somebody or somebody will call and say they had a total knee replacement 6 months ago or 2 years ago or even 5 years ago, and it just never felt the same. It just never was not painful. It's always stiff. It still hurts. How is that possible if the pain was coming from the knee joint?
Right. The knee would feel better with the artificial knee if the pain was coming from
the joint
itself.
Because it's plastic. Plastic doesn't hurt.
Right. But what are some other causes of why the knee could still be hurting after a knee replacement?
Because of all of the soft tissue surrounding the knee joint. When you never fix the reason why the problem occurred in the first place, you're never going to get out of pain. Just because you replace the joint doesn't mean that you fixed the inflammation that's occurring around the joint, all of the soft tissues that cross the knee joint. And what's the number one cause of knee pain?
Weak butt.
Weak ass syndrome.
All right, got one.
Yeah, you did it. Good
One
job,
for
babe.
me.
Good job, babe.
Yeah.
Yeah, the number one cause of knee pain is weak ass syndrome. So the glutes are not doing their job. When the glutes are not doing their job, it places increased compressive forces on the knee. Mm-hmm. So yeah, it's going to wear out the knee joint faster. Go get the knee joint replaced.
So we can say, don't yell at me when I say this, but we can kind of summarize that arthritis is not really painful. It's what's causing the arthritis, what's causing the cartilage to break down, what's causing the inflammation that actually is what's painful. And most of the time that is the soft tissues around it or a muscle group not activating the way it should.
I know exactly what you're trying to say, and you're correct. However, I do want to use some more accurate terminology. Meaning that if we're going to stick with the knee joint, it's not necessarily arthritis that's painful. It's osteoarthritis, meaning that the joint, the bone pain, that is painful. However, with that said, there is inflammation surrounding the knee joint that is independent of the joint itself. So it's independent of the arthritis, independent of the osteoarthritis, which is also painful, which makes it unbearable. And that's what ultimately leads to people having 2 or 3 or 4 or 5 injections in the knee joint, and then those injections don't work anymore, and the pain is just so unbearable, just chop it off. Give me a new knee. So you're essentially getting rid of, in this case, 50% of the pain response, because let's just say for simplicity's sake that 50% of the pain is coming from the osteoarthritis, but the other 50% of the pain is coming from the inflammation surrounding the knee joint. And that's what pisses people off is I had a knee replacement thinking that I was going to have a pain-free knee. It feels better, but it's not pain-free, or worst case scenario, it doesn't feel any better, or it even feels worse after the knee replacement. That's because we're not addressing the inflammation surrounding the knee. All of the muscles surrounding the knee joint are being overworked and underpaid because your ass is not working, is the most common thing.
Right. And it's not uncommon that if you can't get your knee straight before the surgery, that even after you have a knee replacement, you still can't get your knee straight because your muscles aren't activating appropriately or the inflammation is still there. So you're still going to have pain also.
Correct. And speaking of straightness, let's go out and say this on the record. Whenever you have a knee replacement and you go to the cookie cutters or us physical therapy department, they're always 100% fixated on, let's get the thing bending again. We've got to get at least 100 degrees of bend or flexion so you can finish a full turn on the bicycle, meaning that you can't ride a bike with less than 100 degrees bend in general.
Right.
And usually the goal is you got to get at least 120 degrees bend or flexion in the knee joint to be considered normal, quote unquote, normal. However, the bend is irrelevant. The first thing that we focus on is straightening it. You've got to get that knee completely straight, passively, with overpressure, pain-free. And what that means is you're laying flat on the table, and I come up and I put my hands on both sides of your knee joint, and I push down until the back of your knee is touching the table, and it does not hurt. That is the definition of a straight knee. So many times people, when I'm having conversations with people on the phone about this problem, they'll say, my knee's straight. And I'll say, yeah, I'm sure it is. Until they come in for their first session and I do that test, I try to push the back of the knee down to the table and they're like, oh my gosh, that hurts so much. Ah!
And why is the knee being straight important post knee replacement?
Oh boy.
Whether they have a knee replacement, don't have a knee replacement, have knee pain, the knee has to be straight for what reason?
Biomechanics. When your knee is straight, it actually unloads the compressive forces on the knee joint. When your knee is just slightly bent, I'm just talking a couple degrees of bend in it, you're increasing the compressive forces on the knee joint, and that's what causes knee pain.
Got it. So if you're having knee pain, if you're having back pain, don't just sit around and don't Google motion is lotion. If you're having knee pain, one of the first things you need to look at or have someone else look at because you're too subjective to be objective is, can you get that knee straight passively?
Well, technically,
over straight.
Can you get it straight actively using your glutes? And then rehab-wise, yes, can we get the knee straight passively? Can somebody push your knee, the back of your knee down to the table and it doesn't hurt?
Right.
Yep. So that's knee pain. We're already pretty far into this thing. What else do you want to talk about?
So what's a take-home message for the clients? We're going to post the pelvic correction. Because
here's a take-home message right here is when something hurts, non-traumatically, rest is not the answer. Neck pain, shoulder pain, elbow pain, wrist pain, knee pain, foot pain, back pain, hip pain. When those things start hurting and there was no accident, rest is not the answer. Meaning that you can rest and a day, a week, a month can go by, and then you can start moving again and you might not feel that pain again. But if you did not do anything to make the pain go away other than rest, put some ice on it, take some pain medicine, I promise you it will come back. It will come back, and it usually comes back exponentially worse.
Right.
So rest is not the answer. The answer is figure out why the thing was hurting in the first place.
My answer is to see one of your PTs.
Yeah, either in-house or virtually. And now is a better time than ever because we just came out with these new programs. We've got the Better Back program. It's a very simple 6-part series, short videos, 5-minute videos that just takes you through some very basic things. The pelvis correction is one of them. Fix your pelvis, do some soft tissue work, get some muscles activated, how to get your core and glutes firing, and that takes the stress off of your glutes or your back. We've got the posture program, which does a very similar thing, but is more geared towards your upper back and your neck and your shoulders. We can do virtual sessions, so you don't even have to be in Naples. If you are in Naples, just get your butt in here and let's look at you real quick. Quit putting this thing off. Rest is not the answer, damn it.
Right. Learn what you can do at home, on your own, in the gym to keep up your quality of life, prevent this pain from becoming a recurring pain. Figure out what kind of exercises you can do on a consistent basis to treat the problem and not the symptom.
Correct. If you don't do anything about a certain pain that you have, it will get worse in one of two ways, if not both ways. Way number one is it'll get worse in intensity. Like it just gets more intense, more painful, more frequent. Or number two is if it doesn't get worse, it's because you're not doing the same things that you were doing. Meaning that if you have back pain while you golf, but then you stop golfing so you don't have back pain anymore, it's still worse because now you're not golfing, you're not doing the thing that you love to do. So the one thing that I can promise you is if you don't do anything about whatever pain it is that you have, it will get worse either physically or in your quality of life. You're going to stop doing things that make it worse.
Right. And you have tons of YouTube videos. So I would
11
suggest
billion.
11 billion, 5,800. I would suggest going on YouTube and trying some of the rehab type exercises for whatever body part you think you may be struggling with and see if you can gain some traction there. But then having the virtual or in-house visits can be the icing on the cake.
It's a great starting point, and it's really for people that are just apprehensive or they don't want to quote unquote commit. They don't want to spend money on this problem is another big one. The challenge with that option is how do you really know that you picked the right video?
Or that you're doing it correctly.
Or that you're doing it correctly because majority of the time it's going to take 2, 4, 6, sometimes 8 weeks of doing something over and over again the right way before you start to physically notice an improvement. And that's a long time to do it without 100% confirmation that you are doing the right thing. And that's the main attraction to consulting with me or one of my team members, because we can see you in 20 minutes and say, okay, here is the right thing. I'm 99.9% sure that this is the right thing for you to do. So let's do this and get this thing going in the right direction.
Right. Even for us who live it every single day, we have to have somebody else look at us and make sure we're doing it appropriately because, again, you're too subjective to be objective for yourself, or you can't see yourself in certain positions to make sure you're doing something 1,000% correct. So
yeah,
I just did it for you a couple weeks ago.
Yeah, I was doing squats. We're both working out at home one day. And Jenny was on the spin bike and I was doing squats in front of her. And she goes, left cheek up. I'm like, what did you just say to me? She goes, get your left hip up higher. So I lifted my left hip up higher as I was squatting down. I'm like, oh my gosh, I feel way more muscles working now.
Yeah.
But if she had not corrected me on that little thing right there, who knows when I would have started hurting again. Maybe a week later, maybe a month later, maybe 6 months later, but ultimately I would start hurting again because I was doing something just slightly incorrectly.
Right. Cool. I think that was helpful. Yeah.
Good take-home messages here?
Yes. I think that was helpful. Don't wait. If something is bothering you, don't do nothing. It's going to get worse.
Promise you it will get worse.
Figure out where the problem is coming from. Motion is lotion.
Yep.
You don't need an X-ray most of the time. Cool. Happy Monday.
We ended strong, right?
Yeah, I think it's all strong.
Yeah. After that, what was it? Ranting opener.
Yeah, that was a rant. But then we talked about PSLs and made everything better.
Yeah, the PSLs. Gotta love the PSLs. Okay, that was a lot of fun. Thank you, everybody. Have a great rest of your day. And next week's going to be a fun one. You won't want to miss next week.
Yeah, don't miss it. Ciao for now. Thank you for subscribing on your social media and podcast platforms to the Berman Method. Dr. Jake Berman with Berman Physical Therapy and Jenni Berman, Physician Assistant with Berman Health and Wellness. You can find more information on our website, www.bermanpt.com for physical therapy, bermanpt.com/wellness for the health and wellness. You can also find us on social media, Facebook, Instagram, and on your podcast platform. So be sure to follow us, like us, subscribe to us. And if you would like any further information, definitely visit our website and reach out to us. You may also find our free reports on the websites as well, where you can download this free information for yourself. Have a great day.